Thank you for joining our conversation today about breast self-awareness and also about just knowing your body overall for your long-term health. As we start our conversation today, the previous recommendation had been to do monthly self-breast exams, and that really caused a lot of anxiety for people in terms of how do I do it? How do I know I'm doing it right? What am I looking for? All of that. And really the understandings become, this is all about knowing your own body. And so that you can tell your doctor if something should change. Do you find that that's something that you're able to apply in your life? Does that advice help?
I think the new advice actually feels like a bit of a relief, right? Because there was so much pressure around the self-examination and really knowing if you were doing it correctly. And so for me, it's a lot easier to just know my body in general and overall,
I would say the same. I was never good at self-exams, but knowing what it should look like or what it has looked like all my life, and being able to go in and say, this wasn't there last year, can you look at this? I have moles and freckles, and looking at them and knowing what it should look like, especially knowing your girls and what do they look like normally and at certain points in your monthly cycle, I think is more important, to your point, than of how do they feel.
Right. I mean, it could be, just a quick look every day, or it could be once every few months, but it's just that awareness of, does everything seem like the way it's been?
And I've shared, that I have a fairly new doctor, and in my search for it, I had certain things, on my list of what I wanted, and I want to say it was my first appointment, I let her know, I'm kind of like a part-time hypochondriac. I always think something's wrong with me. Like, seriously, I'm like, oh wait, my throat feels a little different, or, And she's the one who said, you know your body, and kind of like reassured me that you know your body and learn about your body if you don't. And if something does change, then yes, come to me and let me know. Like, maybe not every little thing that I think is wrong, but she really advocated for that, to learn your body, know your body. Something changes, let me know. And so I saw that as kind of like an open door, like a welcome mat. Like, okay, then I feel like I can do that if I do notice something different.
I think sticking with it too, Jennifer, is really important. I've heard stories about people who have noticed something and they've gone to their doctor and questioned it, and the doctor's kind of brushed it off as it's not a big deal, and then later come to find out it actually was.
I actually had that happen. I had one day, we were just actually on a road trip and coming home, and I had this pain in my side, and I was like, that's my right side. That could be my appendix. We stopped at the emergency room. The doctor's like, I think you're fine. It's probably gas. Go home. And the next day it was still there, same pain, same spot. And I was like, no, this is not right. And it wasn't even super painful. It wasn't like, my appendix is going to burst. Well, I had appendicitis and I was emergency surgery and they got it out. If I had not trusted myself, it would have been serious. You can trust your doctor, but you know yourself the best. Your doctor has a body of knowledge. That's medicine. You have a body of knowledge. That's yourself. And I think that you said you were a part-time hypochondriac, which is super funny. But also I think that part of that is you're aware, right? I mean, things come and go in our bodies all the time, I think, but knowing and like paying attention. And I think that's what like knowing your body is about. It's just paying attention.
And, I think unfortunately we've probably all been in that position where somebody has said, you're fine. And I think in that moment it becomes important to ask, well, when should I worry? What are you looking for that would change your mind? What's that threshold? Because then they might describe that. It's like, oh, well, if it's waking you up at night, if it's keeping you from doing this or that, it's like, oh, it actually is. Let me tell you more. And then all of a sudden now you're in a different conversation. So as we think about, what have you learned in terms of as you've gotten to know your own body? Are there tips or advice that you would give to others who are thinking about, wow, I should maybe pay a little bit more attention?
I think as I've gotten older, I've gotten more comfortable with really paying attention and, looking at my body and looking in, the spots where you might not typically look, about how does that look? That lump feels strange. That spot looks funny. So I think it is understanding and knowing what your body looks like and what's there and what shouldn't be there and what's changed. So it's going at this with just that comfort level of, this is about knowing what my body should look like and what it does look like and what's changing.
I think about this notion of self-care and self-love and how often it's tied to like, I'm going to treat myself with a coffee today, you know? But really, self-love is about paying attention to your body and advocating for yourself, right? Understanding if something comes up that's not normal and bringing it forth to get it tackled right away.
As we get older, we have that as our self-diagnosis of, oh, my back hurts. Oh, it's because I'm getting older. But like recognizing, okay, this is a backache because I was gardening all day versus something doesn't feel right. Like, I think being able to distinguish the two and go in and find out, and maybe we find out it is because we're getting older and these are creaks that we have, but maybe it's something else.
I had a friend who was a nurse, and she said, if you're concerned about something, go see your doctor. People will say, I don't want to bother my doctor. She said, that's their job. That's what they're there for.
Exactly.
You know, don't worry that you're bugging somebody, and that's your resource, and you're worth it.
And part of it really depends on how much is it impacting your day from day to day. You know, is it causing you to have to do something different than you normally would do to navigate it? Because I think that sometimes that's what we do. We change our behavior so that that symptom doesn't play into it. Then we're fine. And it's like, oh, but it's still there. So if you've had to really adjust what you normally do, how you would normally approach something, if you've had to limit your activity in order to not have something happen, those are things to really, I mean, that's a change. You know, that's part of that change that you've made to accommodate for it. Then yeah, you should have a conversation because you should be able to continue doing all those other things. Well, thank you all for joining our conversation today to talk about, you know, how really knowing yourself helps to improve your long-term health. So in our last little bit of time, what should people keep in mind?
It's okay to ask for help. It's okay to ask your partner to help you or to have somebody, your doctor, somebody else help you monitor. It's like, hey, if I complain about this again, help me.
Treat yourself, right? Not only to that coffee or the massage, but just understanding your body and knowing yourself a little bit deeper.
Yeah, for me, I think it's all just about paying attention and trusting yourself for sure, to know yourself the best.
And not be afraid to ask for help. We need to know our body and then also advocate for our bodies and our health.
Thank you all today for this conversation just about knowing our bodies and advocating for our own health. And I really appreciate you sharing your experiences and advice.